So I think I'm looking forward to the presentation by Dr. Hutchings. He will talk about bispecific antibodies in diffuse large B-cell lymphoma. We've had 2 approved in the last several months, so it's a big momentous shift with the availability of these agents. More so because we've all failed to have quality treatment options for patients post-CAR T-cell therapy failure in diffuse large B-cell lymphoma. So having these agents, which both have shown some efficacy in the post-CAR T setting, is important, and these is epcoritamab and glofitamab, both are CD20, CD3 bispecific antibodies. So as we get more of these agents integrated into our clinical practice, we'll get hopefully more comfortability, especially in a community setting where they have had very little experience with bispecific antibodies. But at least for the academic centers, it gives us a readily available use in this patient population without having to go through a clinical trial setting. I think additionally, we will see some other updates from Dr. Weston talking about the new standard of care in second-line diffuse large B-cell lymphoma, which is, at this point, CAR T-cell therapy, which is now shown to have an overall survival benefit in the second-line setting compared to those autologous stem cell transplantation for patients with refractory diffuse large B-cell lymphoma. And then I think lastly, we will see Dr. Kumar talk about high-risk patients with mantle cell lymphoma, which is a struggle because we don't really have a standard of care for this patient population, at least historically, anything that will give long-term durable responses. So it'll be very important to see what she has to say about this patient population, maybe some updates from some novel therapies, and eventually we would hope to get more updates from the Triangle study, which is a German study that looked at the addition of ibrutinib to R-CHOP, R-DHAP in newly diagnosed mantle cell lymphoma patients to see if those high-risk patients in that study actually had improved outcomes to what we historically have been noted to see in that patient population.